Welcome back, Straight Talkers. If you have young children, you've likely had the pleasure of experiencing tantrums. So today I'm going to talk about 5 tips you can use to help calm these situations and prevent further meltdowns from occurring. Managing tantrums is hands down one of the most unenjoyable aspects of parenting young children. And unfortunately, they're developmentally normal and something that all children experience at some point or another. They often peak between 18 to 24 months, subside for a short amount of time, and then peak again at around 3.5 years. Young children, like adults, experience a range of emotions, including anger, fear, anxiety, and excitement. However, the difference is that young children often don't have the communication skills or the coping mechanisms that are required to deal with these big emotions. Heck, some of the adults I work with don't either, so we can't expect a young child to get it right 100% of the time. The path of learning self-calming mechanisms starts at birth and progresses throughout development. A baby starts understanding words at around 6 to 7 months. They start to speak at around 1 year. And the part of their brain responsible for emotion regulation isn't completely matured until they're in their mid-20s. And this is an ongoing learning process. And when you mix an undeveloped brain that struggles with concepts such as impulse control, delayed gratification, and emotion regulation, with the frustration of trying to communicate your needs, tantrums will result. Sometimes these are triggered, while other times they seem to come out of nowhere. And during these times, we see things like impatience, stubbornness, greed, and aggression. There are 5 tips that I try to keep in mind when my 1.5-year-old starts to struggle with tantrums that I think will be helpful for you to know as well. Tip number 1 is to calm yourself first. You can't fight fire with fire. And remember those mirror neurons that we talked about not too long ago? This is where they come into play again. Big emotions are contagious. So don't let your child's emotional dysregulation cause you to become emotionally dysregulated as well. Don't return your child's outburst with sarcasm, humiliation, or removal of your love. Your child will just feed off of it and a power struggle will ensue. We want to model healthy coping mechanisms, as we all know that example is the best teacher. There are a few techniques that I use when I feel like I'm losing my patience and my emotions are getting the best of me. The first thing I try to remember is that my son's brain is the size of a squirrel's, which is a little bit of an over-exaggeration, but it helps keep my mind clear and prevents me from getting wrapped up into his emotions. It's all too easy to take our children's tantrums personally and think that they're behaving maliciously or being bad intentionally. This is not true. Remember, tantrums are developmentally normal. If this doesn't work, I then take a few deep breaths. Calm breathing can help center you and allow you to think more clearly. Another strategy I find helpful is splashing some cold water on my face or holding a cold pack on the back of my neck if I'm feeling myself escalate. Doing quick bursts of intense exercise, such as running in place, jumping jacks, or push-ups, for a minute or so can be calming as well. All of these techniques have been shown to quickly bring down intense emotions and allow us to have more clarity in our thinking. In the worst case scenario, assume your child is safe. Walk away for a few seconds and then return to the situation once calmer. Tip number 2 is to ensure safety. This can be accomplished by calmly yet firmly moving your child to a new location. Get them out of reach of anything that might be thrown or damaged. If you're in public, also consider moving them to a private corner or carrying them out to the car. Sometimes during tantrums, kids will bang their head or hold their breath in an attempt to vent their frustration. If you're worried about them harming themselves while headbanging, pick them up without getting angry and move them to a softer spot. This might be to a carpeted area or to their bed. You could also consider putting a pillow under them. And during this time, you can softly communicate to them that you love them and are there for them when they're ready to calm down. And even though they might not be able to understand you, your calming voice can help de-escalate them. Breath holding typically occurs in toddlers between 15 to 30 months when they get mad, startled, or scared. Basically, they experience a big emotion, try to cry, and then they forget to breathe. And it can last up to maybe 30 to 40 seconds, cause them to turn blue, and lead to them passing out. Once they pass out, they automatically start breathing again and wake up shortly after. If you're able to get to your child before they pass out, you can prevent these spells by blowing a hard puff of air into their face. Another way to prevent them from passing out is by wetting your hands and then sprinkling cold water onto their face. Both of these techniques prevent the spell and usually lead to the child gasping and starting to breathe again. Tip number 3 is to not reinforce the tantrums, meaning we don't want to give in to our child after we've set our expectation or try to coax them of the reward after we've made our decision. All too often, parents are understandably desperate to get the behaviors to stop and will go against what their original parenting decision was. However, this is only a band-aid, and while it'll stop the tantrum in the moment, it only makes things more difficult in the long run. Once a child learns that they can get their way with explosive behaviors, it becomes a tool they'll consistently turn to and use when they want to get their way. The message we send to them by giving in is basically to do whatever it takes to get your way. When we always try to step in and rescue them from experiencing big emotions, it also interferes with them learning their own self-soothing coping mechanisms. We want to let them have their feelings and also teach them how to appropriately manage them. The message we want to send to our kids is that it's okay to have big emotions and that we love them regardless. Tip number 4 is try to connect with your child. Research shows that in order to influence a child's behavior in a positive way, we need to first connect with them. Therefore, we want to avoid punishing, lecturing, scolding, or shaming them during this time. When their brains are flooded with emotion, they can't think clearly, and excessive use of words is like throwing fuel on the fire. We want to soothe the child prior to dealing with the problem. So the goal in this moment is to calm them and not to punish them. Appropriately connecting with your child can stop tantrums on the spot. When a child feels connected, this is often enough for the misbehavior to stop. The way we go about this can vary from child to child, and the first step you want to take is to get down to their eye level. So if they're sitting on the floor, you should squat or get down on the floor with them. Some children will respond positively when you echo the feelings they are experiencing. Even if they can't understand you yet, naming feelings helps them feel validated and understood. In addition, children learn language best when it's spoken to them, and labeling their emotions will help build their vocabulary for a time where they're more able to connect their emotions with their words. In addition to naming emotions and validating their feelings, other children benefit from things such as gentle touch, soft music, or deep breathing. It is worth noting that well-meaning stimulation can actually be more provoking for some children. These types of children do best when you sit nearby without speaking or touching them. Just being there is supportive for them, and they will come to you for that physical touch and words of affirmation when they're ready. Once you're able to connect with your child, continue to sit with them, allow them to catch their breath, and give them time to let their brain reboot. At this time, it's also helpful to reassure them how much you love them despite how inappropriate their behaviors were. Don't be surprised if the tantrum is followed by tears. It's often how their little bodies process the flood of emotions they just experienced. Continue giving hugs and reassurance. After your child starts to calm down and is in a more receptive state, this is the time to deliver whatever message it is that you have. It's encouraged that this is done kindly, yet firmly. Another option would be just to let it go, focus on how to prevent tantrums in the future, and continue loving on your child. In some situations, trying to connect with your child might result in even louder crying and tantruming. In these scenarios, we turn to tip number 5, which is to kindly ignore them. Some kids just need some time to express their emotions and let steam off, and as long as they're doing it safely, we can let them have their space. When my son is having a meltdown that is non-responsive to connection techniques, I'll go and pretend to do something for around 20 to 30 seconds, and if he stops crying, I'll quickly return to him and try to connect with him again. And this might need to be repeated a few times. If he's feeling extra spirited that day and continues to cry despite me coming and going, I'll simply just let him cry it out for the 2 to 5 minutes it might take him to calm down. When he finally starts to calm, I'll watch him out of the corner of my eye as he starts to play with something new. And then I'll slowly approach him and sit next to him. And during this time, I won't say anything, and I'll be very slow to make eye contact with him, as he's probably still somewhat upset. And then slowly, I'll try to reconnect with him by joining in with whatever task he's doing.